Hi, FreeBody massage community. Kat here in Asheville, North Carolina, USA. And this video is going to show you very specifically how to release the piriformis muscle. Now, hopefully you have watched already the anatomy of piriformis and the deep six lateral hip rotators. I'll drop a link in the description to that video. After I released that video, so many people asked me for that specific work. So here it is, how to release piriformis. Now, I'm gonna say a couple things. One is piriformis gets blamed for a lot of sciatica symptoms. Sometimes it's a player, but it also is not always the deep root of sciatica symptoms. So you will also want to work with gluteus minimus, and gluteus minimus really can create a lot of those sciatica symptoms. Folks seem to really want to blame piriformis. Again, piriformis can be a player, but not always the root. And in that anatomy video, link in the description, you'll see that the piriformis muscle, the medial attachment, runs right next to that sciatic nerve. So yes, it can compress on the sciatic nerve. Yes, it can cause sciatica types of symptoms. Now, one other thing I would like to mention is that piriformis gets really jacked up with tension, often on the high hip side. So if you have clients with a leg length inequality, what I like to call a hip height inequality, you'll see that piriformis on the high hip side where that pelvis is getting turned, that medial attachment, that higher attachment is getting pulled, and that's going to pull on that piriformis and can stimulate some sciatica type symptoms or some piriformis issues. So deep dive into piriformis release work. I really hope you liked the video. Please subscribe, give a like if this information is helpful, drop a comment. Also, I'm always taking videos by request, so send me a message in a comment below. Let me know how I can serve you. Let's get into this really amazing piriformis release work. So now we're going to do some work in the piriformis, and you can do this work through a sheet, and that gives your client a little bit more privacy. And I'm going to just show you how I like to begin a little bit of compression through the sheet, and then I will show without the sheet on. How to palpate and where to find that piriformis. So just doing some nice compression and sinking. So here's the sacrum right here, and I can feel there's the very top of the butt crack. That's where the tailbone begins, right? End of the sacrum is top of kind of that crease, the butt crack, for lack of a better term, I suppose. And we know that our piriformis goes from the sacrum out to the greater trochanter of the femur. So always nice to just do a little compression through here, through the glutes, and helping her body just get ready for the work. And so now I'm going to take that sheet off so that you can see more clearly where I'm working. Sacrum, that's right where it dives and becomes the tailbone, the coccyx. And I want to make sure that I'm not digging my hands or sinking my knuckles into the sacrum itself. I'm just kind of following along it and then down through the glutes and kind of tapping in with that deep six right there. So then when we're ready to really release our piriformis, there's two main trigger points in the piriformis, one at the sacrum and one near the greater trochanter of the femur. So I want to, with flat fingers, palpate and just find that edge. Here's tracing the edge of the sacrum. Tracing, tracing, tracing. And then here I can feel it. See how it starts to curve inward? Here it's coming down, and then it kind of takes a little bit more of a curve. So right around that curve is that first main point in the piriformis muscle. So here's the sacrum. I'm going to slide off the sacrum, and I want to come about almost an inch, half an inch to an inch off the sacrum so that I can sink down. I'm going to stack my thumbs. I'm going to sink down toward the floor just a little bit. Then I'm going to turn my thumbs and I'm going to trap it. I'm going to slowly sink toward the sacrum. Brooke, you're going to let me know if there's a tender spot there. There is a tender spot there. So I'm going to have her sink, breathe, letting your whole body relax down into the table. Mm-hmm. And Brooke, would you like more or less pressure? A little more. So all I'm going to do is sink my body weight forward. You let me know when it's enough. All right, right there. And then a couple of nice breaths here, relaxing your whole body down into the table. Beautiful job with the belly breathing. Mm-hmm. And Brooke, does that point feel a little easier now, a little less tender? Mm-hmm. Great. She said yes, so I'm going to slide up. Notice I don't just whip my hands off. I'm going to back out slowly, okay? And then always nice to just do a little bit of compression. Mm-hmm. And we're just going to, now that we know, have that good idea of where things are, you can slide the blanket or the sheet kind of right into the fold of the glutes so that you have a little bit of visual. You could slide off it and then come down. Remember, when you're going to go in, you gotta, the piriformis is a little deep in there. So you have to come off the sacrum enough to allow yourself to sink down through the glutes to then turn and go into that point. Okay, so that was point number one. Now we're going to palpate and we're going to find that greater trochanter of the femur. Really what we're just looking for is the very top of the femur as it dives into the hip socket. So here we have the top of the femur as it dives into the hip socket. The outermost portion of that we can palpate is the greater trochanter. And we know our piriformis attaches right into that. So you want to come up and around. You'll feel the thickness of the top of the femur there. You're going to come right off it. Now if I'm following through here, what's back here is my lateral hip rotators, the deep six. I come right to this top edge. I can feel the top of the femur. If I'm up in here, there's no more femur, right? So I want to be right at that top of the femur. And again, I want to come off that tissue a little bit, so I'm going to come about an inch medial so that I can sink straight down toward the floor and get into that piriformis. Let me know, Brooke, is it tender there? Mm-hmm. And there's another tender spot. And I just have my thumbs right next to each other. They're kind of supporting each other. Very top at the back edge of that greater trochanter and the hip joint. Piriformis trigger point number 2. And how's that feeling, Brooke? Is it the same? Do you want more or less pressure? It's the same. Okay, so we're just going to hang out here. And bring your attention into that whole left leg. And as you exhale, let that whole left leg sink down into the table, letting your whole body soften. There, nice. Did you feel that change? Mm-hmm. Mm-hmm. Now our options with working with trigger points, again, is that we can just allow our client to sink and relax, or we can have them do a little bit of movement, which always makes it a bit more exciting. So I don't like to start with the movement right away. So Brooke, I would like for you to just start to rotate your thigh in and out, like all the way down the femur. There you go. Notice her heel. You might not be able to see it. Her heel moves out. That's opening. That's internal rotation. And then now she's going into external rotation. And she can choose how much she pushes into that. So she's going to keep waving that thigh in and out. She's internally rotating. The whole thigh is rotating. Her heel moves outward. Now she's going to externally rotate. The heel moves inward. Can you feel how that changes it, Brooke? Maybe do that a few more times. And the movement, yep, it's great. So she's kind of pushing into it at the ends. Notice I'm kind of along for the roller coaster ride. I'm still sinking into this spot. I can feel the head of her femur rotating underneath my fingertips. The more she goes into that external rotation, the more I feel that piriformis contract. Now as she goes into internal rotation, it opens up that space. I can sink in. Do one more time, Brooke. She's rotating that femur in. Ooh, it's so exciting. But notice, I don't know if you can see fully, her movement has gotten much bigger. And that's often a great indication that things are shifting. Much, much bigger. And then you're going to come back to center. Yeah, let everything relax. How's that point feel now, Brooke? Still a little tender? Tender but different. Great. Not as sharp, more dull. Great. So we're going to slowly come out. We want to just give a little compression through there. And then I like to just place my hand and sink. Here's the sacrum, here's the top rim of the pelvis. I'm kind of on the top edge of the piriformis, a little bit of glute med. I'm kind of tractioning her femur down and out of the socket a little bit. I'm just kind of giving some nice steady compression. Steady compression is very soothing to the nervous system. And now we're going to do that on the other side, and I'm going to do that one through the sheet. Great. Because often when you're working in the piriformis, you are working through the sheet of your client. So again, starting with some nice steady compression. Second side, piriformis. Always wanting to start with just a little bit of nice compression, partly because it feels so good, and that's going to help your client to relax. I'm just using a soft fist, soft knuckles, rocking my weight forward and back. As my weight rocks forward, my hands sink into her body. Is that all feeling okay? Great. A little bit of that compress and drag. A little compress. And always when I am starting with some compression, I'm feeling the edges. Like right here, the heel of my hand is right at her sacrum. So I want to slide off that sacrum a little bit. So now you can see that edge of the sacrum just sinking into the soft tissue. I don't want to push her bones. Yeah. And then I'm coming now to palpate. Remember that the coccyx begins at the top of where the butt crack is. And so I know that that's the bottom of the sacrum. So here's her sacrum through this area, and it's about this wide on my friend here. So I'm going to come to that outer edge, and I'm going to just lightly palpate. I'm not pushing real hard. I don't want to push real hard when I'm palpating. You always want to use flat fingers, flat thumbs, and just not very much pressure. So here I find that turn where the sacrum is nice and wide here, and then it takes kind of an obvious turn inward. Here it's out here, and here it turns. So right at that intersection around that turn is where the top edge of the piriformis is. So finding right where around that turn is, that'll be a good indication that's where your work is going to be. And so I just keep kind of palpating along. There's the turn. So I'm going to slide off that sacrum, come out about 1/2 inch to 1 inch. I'm going to stack my thumbs. And then the first thing is I'm going to very slowly just sink down toward the floor, just a little bit. So remember that that piriformis is deep in there, so I got to get down to its level first. Then I can turn my thumbs facing toward that sacrum, and I angle right into that sacrum. You let me know when it's at the edge, Brooke, when it's enough pressure. Right there. Okay. And that's a tender spot for you? Would it be more tender if I slid down a little bit? Let's just try. Sometimes you got to fish around a little bit. Is that more or less than the other spot? More, yep. So see how it's curving around there? It's kind of usually right at that kind of curve area. And Brooke, how does that amount of pressure feel? Does that feel right to you right now? Yeah. Okay. And so we're going to let her take a couple of breaths. I'm also breathing in my belly. Now is a good time when I'm holding a point to check my body mechanics. And then, Brooke, if you'd like to start doing some movement, you can start rotating that femur out and in. And it can be kind of fast movement. Doesn't have to be real slow. It can be out and in. Nice. And can you feel that point change as you do that movement? Great. So we want to make sure that they can feel a difference, because as they're engaging and stretching the muscle we're working on, their experience should change. Yeah. Let's do maybe a couple more times. I can see her range of motion is increased a little bit, so that lets us know that things are changing. And then, Brooke, do you want more or less pressure? Tiny bit more, so we can sink in just a little bit more forward. All I did was lean my body more forward. I don't want to push. I don't want to use my arm strength. She's doing a great job. And I can feel that contract, especially at the very end of her external rotation. I can feel that piriformis kind of right under that thumb. Great. And you're going to do that one more time. Nice. Just really feel that. It's so fabulous. And then you're going to relax everything. And does that point feel any different than when I first began? Much different. Much better. All right. So I'm going to come out now. Right here is that first spot. So I know that that outside spot is going to be not too far away, kind of right in a line. I'm going to keep a thumb on that spot, and I'm going to palpate that outer hip area to find that greater trochanter. Now, I can also palpate back here. I can feel the bone. The top of the femur is right here. And if I go up higher, there is no top of the femur there. So I want to get right at that very top edge. Nice flat fingers for my palpation. Once I find that top edge, that's where that next trigger point is going to be, right at the back edge of the hip socket. So I'm just going to adjust that a little bit. And then I'm going to stack my thumbs. I'm going to move away from that back edge a little bit. So I'm going to come medial toward that first point a little. I'm going to stack the thumbs, and then I'm just going to sink my body weight down. Brooke, you let me know when it's the right amount of pressure for you. Right there, she said. Great, and then we just hang out. Whenever I'm going to invite a client to do some movement, I want to give them a couple of breaths first. I want to give the nervous system just a moment to accept the work. I'm not forcing the trigger points out. What I'm doing is working with her nervous system. This is trauma-informed. So trauma-informed means that I honor the nervous system every step of the way. I don't want to overwhelm the nervous system. And so I'll say things like, if you're getting mad at me, it's too much, right? So I can always back off, or I can always sink in more deeply. So Brooke, you can let me know. It feels like it's softening a bit. Do you want a little more pressure in there now? Yep, I can feel that softening away from my thumbs. So all I'm going to do is lean my body in. Right there. See how much deeper we went? This is totally opening beautifully for us. And then Brooke, you can choose. It seems to be releasing nicely without any movement. But if you'd like to do a little bit of movement here, here's your chance to do a little internal and external rotation. So basically, internal rotation, she's going to move her heel out to the side. External rotation, the heel waves in. And she's taking her whole thigh with her. She's not just moving the heel. She's using these muscles to rotate the entirety of the thigh and the leg all the way down to the heel as one unit. And I can feel it. Oh, it gets real contracted right there. She really goes into that external rotation. And then it softens. You can see that whole area relaxes as she stretches it and goes outward. Last one. Coming in, see it contract. And then moving outward. And then you can relax right there, Brooke. Nice big deep breath. And how is that point feeling? Good, better. All right, we'll take it. And then just some nice compression through there. Thank you, body. Thank you, nervous system. Thank you for letting us do this work. We want to always encourage a sense of safety in our work. So we want to really honor our client, their edges. We want to not push deeply into their tissue. Sinking compression is much more soothing to the body than pushing. So when I am doing these more flat hand compressions, I'm just sinking in. Same with the trigger points. When I'm doing a trigger point, I'm not pushing with my hands, I'm sinking with my body weight. It makes a real difference to how the person and their nervous system receives the work. Great.